Imbalance is when you have too much or too little of a certain hormone in your bloodstream. So this is going to show up in signs and symptoms like acne, which is the one that we're going to be talking about today, facial hair, and chest and back acne, and irregular periods for some people, and ovarian cysts, and yeah, things like that. So if you have bacterial acne, it is just definitely being caused by bacteria that is too much on your skin surface. So there's a certain amount of bacteria that you are allowed to have on your skin surface for it to function properly. But then if there is overproduction of bacteria, now it becomes a problem and it's going to cause acne. So we go to the next item, which is how to identify your acne. So for bacterial acne, for you to know that it's just being caused by bacteria, it is just acne on your face. You don't have any other problems. You don't have irregular periods. You don't have facial hair. You don't have cysts. Yeah, it's just that. It's just the acne on your face, and it comes out any time of the month. It's not specific to your time of the month as a woman. And then for hormonal acne, it comes out mostly during your time of the month or a few days to that. You also have irregular periods. You also have facial hair. You also have back acne, chest acne, butt acne. They call it buttne, I think. So if you have some of those other symptoms, you don't have to have all of them. For me, I do have facial hair, I have chest acne, I have back acne. So it means definitely I have hormonal imbalance. So another way for you to identify if it's hormonal imbalance, you can go and see a dermatologist. They perform some tests on you and see if your hormones are balanced. If they are not, then you're definitely sure that that is why you have acne. All right. So it's very easy to identify it. If you don't have money for the dermatologist, then you can use those other symptoms that I just mentioned. All right. So after identifying it, we now want to discuss how we can treat it or maybe stop it from coming out. So for bacterial acne, it's quite easy for you to deal with it because it is just caused by dirt. Maybe dusty environments, you touching your face with dirty hands, you sleeping on dirty pillowcases because you don't change your sheets, you not just doing your skincare. So it is just a matter of you doing your skincare properly, probably taking antibiotics for maybe a month or two, and looking out for ingredients like benzoyl peroxide, which actually kills the bacteria. So you can use a face wash or a cream that has benzoyl peroxide and your problems will actually be gone just like that. But then if you have hormonal imbalance like me, it is going to be quite difficult to deal with it because your hormones are not balanced. You have to balance them, and there are ways to balance them. So one of the treatments that are there is isotretinoin, or some countries call it Accutane or Roten. So it's a pill that you take for a prescribed time, probably 6 or 8 months, and it's going to deal with your problems forever for some people, but for some people it might just deal with them for maybe 4 years, 3 years, and then your acne comes back again. So now the problem with this isotretinoin, it has a lot of disadvantages, or should I say side effects rather. It's side effects. So it causes you to have dry lips, dry skin, dry everything. Literally, you are just dry as a person. So it also causes you to have birth defects. That is if you are pregnant or you are trying to have a baby, or if you're trying to have a baby, or if you get pregnant while using it, you might just have, your baby may just have defects. So it is not allowed, not even advisable, it's not allowed to have a baby while you are using isotretinoin. So if you're someone who's trying to conceive, you can definitely not use it. If you are trying to have a baby soon, you don't have to use it because it's going to stay in your bloodstream and it's going to affect your baby. So that is the worst side effect, and personally that is why I did not take it, because when I was told about it, or when my acne became serious, that's the time I was getting married. So I didn't want to just use it, because also my husband didn't agree to it. So I looked for the other ways, which are contraceptive pills. So contraceptive pills actually balance hormones, but not all of them. There is one specific one that I know, which is called the Diane 35 contraceptive pill. So it is actually meant for hormonal imbalance, and because of that, it is quite expensive than the normal pill that costs less than $1. It is quite expensive, so you definitely have to buy that and use that. I used it for 4 months, and that's when my acne actually started to dry up, because it was just coming out and not stopping, despite the fact that I was using CeraVe. CeraVe. CeraVe on acne, it doesn't even recognize that it. In short, CeraVe won't do anything. Okay, for me, it didn't do anything for my acne. So I used the Diane 35 for I think 4 months, and then my acne started drying up. I'm going to insert pictures of what my skin was like and when I actually started seeing the effects of Diane 35. My acne dried up. Of course, I had a lot of scarring, but then it was better than the pimples that I had, because they were huge and not looking good. And another way of balancing your hormones is the use of natural supplements like the evening primrose oil. So they say evening primrose oil is going to balance your hormones. It's a natural supplement that you can take every day. For me, my problem actually worsened when I started taking evening primrose oil. I'm not sure if it was purging. Well, the person who sold it to me said it was purging and I was supposed to continue using it, but the way I was purging was just too much, so I decided to stop and I never gave it another chance. So you can just try the hormonal balance pills that you can get from Discam and from Clicks, and then you balance your hormones. And after you know that your hormones are balanced, you have treated that, then now you can have a routine where you incorporate the CeraVes, the glycolic or what, so that you clear your skin. But I do not advise starting with getting a routine before you treat your hormones from inside, because they are going to stay unbalanced, and whatever you do on the surface is probably not going to work. So it's probably going to be a waste of money and products. Then we go to bacterial acne. I think I've talked about bacterial acne and how to treat it, which is just antibiotics and cleanliness. So yeah, let me hear from you guys from the comments if you have managed to realize now what causes your acne from the things that I've told you, or to identify it, because that is the starting point before we start dealing with it, because the next coming videos are going to be giving reference to what is causing your acne. If you have hormonal imbalance, then you use this ingredient. Make sure this ingredient is in your face wash. Make sure this is in your toner. So you have to identify. This is really the first step to dealing with acne. You have to identify the cause before you look for the solution. So let me hear in the comment section if you managed to do that. If you didn't, I can probably help you with that before we move forward. So thank you guys for watching. I will see you in the next video. It's a series for skincare. Just look out for skincare series every other week. We are going to be talking about that and making sure that everyone finds a solution to their problem. Thank you guys for watching. See you in the next video. Bye.